Very happy to be here. So I want you all to imagine that you were trying to lose weight. Might be a bit distant for some people, but anyway. Imagine you had a scale that was going to help you lose weight, and every time you stepped on the scale, it gave you a number. But let's say that number was a random number and had nothing to do with your weight, and you needed to be able to track whether the exercise or diet intervention that you were using was working. Now let's imagine that being able to track and reduce your weight was critical for your health, your well-being, or even your life. That would be a really terrible situation, right? Because measurement is important. How well we can measure something has a direct impact on how well we can diagnose it, how well we can monitor it, and how well ultimately we can treat it. And the problem of measurement is a serious issue in neuropsychiatry. When we talk about neurological and psychiatric disorders, often the measures that we use to track, monitor, diagnose, and ultimately treat those disorders have some serious issues. So I'm going to give you a bit of a conundrum that we have in neuropsychology specifically. We have many measures that have strong evidence of validity without innovation. So these are measures that are based on our understanding of the mind and brain that's years, decades, sometimes over a century old. And these measures measure something, and you can get at things like, is a person who just had a stroke seriously cognitively impaired? But they don't really incorporate modern technology and our modern conceptualizations of the brain. On the other hand, we have many measures that are being developed that have innovation, but not necessarily with validity. So these are using the latest technologies, and maybe it's in early stages and we don't yet have the data to know whether it's valid, or in some cases, very little evidence that these measure anything at all. So this is not a picture of space. This is, in fact, a graph, a scatter plot. And what you're looking at is a score on attentional bias test. So this is a test of how much you tend to be biased towards looking at threatening stimuli, which we think is really important for a lot of mental disorders. Scores on odd trials of this measure are not correlated with scores from even trials of this measure. This essentially is noise. This measures nothing. You would expect two scores derived from the same test to correlate with each other. And so that's a serious issue. And this is based on a sample of 1,200 people. So when we're using tests that ultimately give us random noise as measures, it's very, very hard for us to treat anything. Let's say, however, that you have measures that are both valid and innovative. So we're using modern technology, and we're using things that, in large samples, we've shown correlate with important outcomes, and that are reliable, and that over time give the same measures, or at least, given the same conditions, give the same measures. Many of these measures then fail when we get to the point of moving to scale. Large populations in ecological environments, the context that we live in, where ultimately we want to treat disorders. There's a failure of generalizability, a failure of scale, and ultimately a failure of ecological validity. And the fact that we can be so far in the development cycle, years in the development cycle, before we realize this is also a serious, serious issue. Now, I think many of us are here at the World Medical Innovations Forum focused on AI because we believe that the collection of large-scale data and the mining of that data are going to lead to insights that we wouldn't come up with based purely on theory or a priori predictions. I'm going to show you a measure we developed of visual spatial attention that we were trying to associate with math achievement. One of these two tests is correlated highly with math achievement and one isn't. So let's see if you can tell which one it is. This is the first one. You have to follow the green circles. Not hard, right? Okay, 100% across the board. Good, good. Next one. Okay. So raise your hand if you think it's the test on your left that is related to math achievement. Okay, I'm assuming that everyone who didn't raise their hand thought it was the test on the right, so you were all wrong. It is, in fact, the test on the left that is highly associated with math achievement. The test on the right is not strongly associated at all. So this is not something that we could have come up with based on our predictions. This is based on looking at random changes of many parameters and many different starting orientations of the dots, and then looking at which trials are associated with math and which aren't, and then replicating that again and again and again. This is from a sample of 44,000 people. So these are the sorts of insights you get with data that would be very hard to generate based purely on theory. So 10 years ago, we decided that rather than developing these neuropsychological assessments and digital cognitive tests in a very lab to clinic and then into the wild kind of approach, we would start by doing it in the wild. So in the wild meaning in the actual real world. So we would create measures, field them immediately into people's homes. So people would come to the site and do tests in exchange for feedback on their results in order to get large samples and in order to immediately be testing on people's everyday devices in their natural environments and in diverse samples. And from this testmybrain.org arose, which is a public research platform that anyone can go to at any time, maybe after I'm done speaking. And the idea is that structured data collection in the wild, we start with engagement, we start with generalizability, we start with accessibility, and we start with ecological contexts. And measures that can go through that cycle and still retain their measurement characteristics and be valid often will work in more controlled environments. So by starting with the messiest, most difficult environment, we can back into the more controlled environment and therefore generalize across contexts. And the engagement model that we came up with, which is very much based on getting people's interest in cognitive assessment and interest in their own minds and brains, has allowed us to collect data from over 2.3 million people worldwide. And we get about 500 to 1,000 new participants every single day. Our unique position is we have a platform technology that allows us to develop new assessments, and we are now the foremost cognitive test development organization in the world that does this in the wild and at scale. We're currently at 194 sites internationally, and we've built over 60 different types of measures. We work with multiple NIH institutes, including cancer, aging, mental health, and diabetes, to develop tests that can be consensus measures for mobile monitoring of cognitive change and other cognitive problems. And these measures, because they can be used across context, include use cases like this. So pragmatic clinical trials, things like concussion assessment, monitoring cognitive decline where you're monitoring in people's homes, studies with large-scale genomics, workplace assessment, performance optimization, and things like product design. So a very wide range of applications, all based on the idea that by starting with engagement and starting with the messy environments where we ultimately want to monitor cognitive differences, you can back into measures that work better at scale. I want to walk you through quickly what this looks like. What does it look like when you develop in this way? So this was a measure of processing speed that we wanted to develop that was based on the entry of an access code, like you would when you open your phone and you want to check your credit card statement, so you often have to enter an access code. So we're going to simulate this process and have it be a cognitive test of processing speed and attention. So we started off with 12 initial prototypes. So these prototypes varied in their instructions and the features of the numerical string itself and the way it was presented and what the person saw when they entered the code. And after one day of data collection, we were able to identify lots of technical and engagement barriers. This is the internet. People are very, very honest. So people tell you exactly what they think is wrong with your test from both a technical and engagement standpoint. So after one day, we got rid of a lot of barriers that were preventing people from doing the test and getting reasonable scores. By day 3, we selected parameters that maximize the sensitivity of the test, so getting a nice normal distribution with minimal range restriction based on initial data from a few hundred subjects. By day 4, we had selected parameters that maximize the ecological validity of the test, so how much this test was simulating a real everyday experience that people have in entering an access code. And then by day 6, we had enough data to start looking at age-related differences and picking those parameters that maximize the age-related differences that we were interested in. Ultimately, this was for the National Institute of Aging, where we were wanting to measure change across the lifespan. So that was a sample of 1,200 people that we collected in 6 days, allowing us to go from prototypes, initial prototypes that we had built, to a pretty well-optimized test in about 6 days. And then on day 17, we presented this test to collaborators and to the NIH along with the original data. So I don't think I need to tell people in this room that neuropsychiatric disorders are a huge human and economic burden in the world, and anything we can do to gain traction on these disorders to help us diagnose, monitor, and treat them is huge. And if we can use digital technology to get to scale and to reduce the cost of doing things like monitoring and improve our treatments, then that's a huge, huge economic boom. What we are looking for specifically today, we're looking for partners who believe in precise, scientifically robust, and scalable measurement solutions like we do. And ultimately, partners who don't have time. So we're not building for a future that's 3 to 5 years from now, or certainly not for decades from now. We are building tools for a future that is 6 months from now, 3 months from now, a limited amount of time in order to apply things as broadly as possible that we think will work. And any of you who share that sort of ideal, I will be in the atrium after this and be happy to chat. Thank you.